different medical academies is to do what's called benchmark care, practice practice excellent patterns. That, for example, it's not cookbook medicine, but what we as doctors should do routinely. For example, if somebody comes in with pneumonia, I have one cookbook, this doctor has another cookbook. He might give a medicine that costs $100. I might give a medicine that costs $5. When in fact, maybe a medicine that costs $20 or the lesser of the medications is just as effective. So it's not necessarily going to cookbook medicine. It's using benchmarks that have worked and have kept prices down.
I think the president used the example of Mayo, which is over here in Phoenix. We've got a team of doctors that looks at patient outcomes, and it's all about the patient, not about what profit that particular procedure might yield to the hospital. Folks here in El Paso don't know really that one of the hospitals here is the most profitable hospital in the country for that chain. The Tenet Hospital over at Providence happens to be the most profitable in that chain. And if you look at different cardiac care costs, let's say at Thomason now University versus Tenet, the costs over there are skyrocketing because what's at the end of it is profit and not patient outcomes. Let's talk about that a little bit. How does that affect, when you've got skyrocketing costs up here, the everyday consumer? What's coming out of their pocketbook to pay for health care?
Well, the important thing about talking about comparing hospitals is that the most important thing, Senator, I believe, is that the most important thing for physicians, and it should always be, is patient outcomes. What it takes to take care of your patient. We also have to do it in a very frugal, conscientious manner. So I think that we need to start working on these, what I call those benchmark patterns, that we need to do best practice medicine in the best practice form.
Let's talk about something that's also being talked about out there. The president's talked about the need to dramatically lower healthcare costs because, frankly, it's eating up the federal budget. It's eating up the state budget. We can't sustain it anymore. You've already mentioned that in Britain, for half the money, they get twice the outcome. So I think most people would say he's exactly right. The other thing he wants to do is insure all Americans. The moral imperative of taking care of our own people. And that's something that every Western democracy has resolved to do. The third is he's going to pay for it, and he's talked about how to pay for it. This $1 trillion that gets thrown around, let's talk about the real cost. The real cost of 1 year is $100 billion of the reforms that are on the table in Washington, D.C. By example, by comparison, the war in Iraq is $114 billion. And the president's been very clear that by taking our military troops out of Iraq, by freeing up money that's otherwise going into military operations there, a surcharge on those that make over $350,000, he's laid out a very clear plan for paying for the costs associated with this plan. I think in looking at that, that's a fair deal. How do you feel about the paying of those costs?
Whatever it takes, Senator. You know, I've been in medicine, I believe, all my life because I really care about people. What you're talking about in terms of healthcare reform, I've been doing for 27 years. The system is broken. We can find a way to pay for it. It's going to take a lot of give and take from all of us. It's going to give and take from the doctors, the medical profession, the pharmaceutical companies, the hospitals. I think it's the right thing to do. It's a moral thing to do. It's an ethical thing to do. We got to fix this system that is broken. We cannot continue this current pace, or else we will all be in serious danger.
Let's talk a little bit about some of the other aspects of medicine that you don't put on the table and hear so often. Today I was at a community meeting, and the Mental Health Authority of El Paso announced that 1,500 El Pasoans will no longer get medical care, the kinds of medications that will keep them out of hospitals or emergency rooms, medications that work, that we know work, because there's no money in the budget. What then happens to those folks if they don't get health care?
Unfortunately, they're going to end up in the most expensive places. They're going to end up in emergency rooms where it costs 10 times. They're going to end up in the jails. I think this is unacceptable. I also think the state of Texas has cut the budget so much that these people will needlessly suffer. And I think it's so important that we acknowledge where these cuts came from, because this should not have happened, Senator. These are 1,500 people that are going to end up in jail. it's going to end up in the emergency rooms, and it's going to cost everybody.
You know, I agree with you 100%. We've been talking about this for years. When folks down in Austin say, I'm going to sign a pledge, no new taxes here. In fact, we're going to cut a $2 off your property taxes. What really happens? They take political credit and then they lack the courage to do the politically right thing to do. And in this case, that money that's not coming at the state is shifted to the local property taxpayer to pay, because that person ends up in our jails. And the El Paso Police Department and City of El Paso have to deal with that person who's having a psychotic event because they had to take them off the street. So what's really happening is the lack of political courage in Austin is producing a political problem in El Paso, Texas. I call that failed leadership and failed responsibility. And I hope people watching this show will realize how that works. That is a state problem. The state has the obligation of taking care of the mentally ill in this state, always has been. The county, which is a state functioning agency, has that responsibility locally with state funding. But when a guy like Rick Perry says, I'm going to cut the budget, guess what? That person shows up at Thomason, and you and I pay it because it's on our property taxes.
We all pay for it, Senator.
That's how it works.
We all pay for it.
Wouldn't it be better if we moved it up, had that citizen on medications and provided health care so that they could be functioning citizens and enjoy the benefits of working in El Paso today?
Definitely, of course, everybody understands that an ounce of prevention was worth a pound of cure. If you can treat them with low-cost medications, you minimize your chances of having a psychotic episode and of ending up in jail or in the emergency rooms.
Well, let's talk a little bit about what's going to happen here in this reform. We're going to have town hall meetings in El Paso, several of them, but on August the 27th, right here in the El Paso Community College Administration Building, we're going to do a big town hall meeting and lay out all of these issues and invite testimony from every El Pasoan so that they can have their voice heard. But the most important thing is to take back a united voice from the city most affected by not having health insurance, El Paso, Texas, that we want reform now. You're going to be on that panel, and I hope you'll let all the citizens know how important it is to come and participate.
I will do my best, and I've been doing, I think most of El Pasoans who know me know how passionate I am about this issue. And I've been, like I said, I've been working on this for 27 years, and I've dedicated, I believe, my entire life to helping the uninsured.
Well, I want to let everyone out there know that we're going to have this forum. You're invited, and please come attend and be sure and let your voice heard. Whether you're a veteran who is enjoying some of the best military healthcare medicine in the world on TRICARE here in El Paso, or one of the citizens here that needs insurance and does not have it, or those that do have insurance and are talking about a better way to do it. We're going to do that August the 27th here in El Paso at the El Paso Community College so that folks can have their voice heard. And what you say and what our vision is of healthcare in this community will go straight to congressmen and senators in Washington, D.C., and we'll use it in Texas, down in Austin, to make sure that we try and improve the health care that we provide to our citizens in this great state. Let's talk about some states that really do a good job in taking care of folks with health care. I want to talk about the Massachusetts model. Here you had a governor named Mitt Romney, actually got up and ran for President of the United States as a Republican, and the signature event of his administration was signing a universal health care bill in Massachusetts. How is that working in that state?
If you ask me, Senator, I think there's a lot of criticism, but if you ask me, I think health care reform is working and it's effective. They are treating people who have not had the chance of having health insurance in the past. They created their health insurance program that covered up to 300% of FPL. And I think in our state, in our city—
What's FPL, just so everybody knows?
Federal poverty limit. They went up higher, and most authorities feel that in order to afford a private health care insurance, you have to be at about the 300% of the federal poverty limit to be able to afford it. So in that state, they created health insurance for everybody at 300% or below. One of the biggest problems that we have and we'll face, and that's what I'm talking about, that we have to have every single entity involved, including doctors, pharmaceuticals, is that because of the greater demand, which is going to affect us, that we need to solve this system. We got to fix the broken system so everybody has a fair share in the system. For example, the doctors will need a fair share, the pharmaceutical companies will need a fair share, but above all, the patient needs to have the fair share. So in my opinion, it is working. There's a lot of criticism about it, but talk to those people who did not have health care and now have health care. To them, it is working. And that's why I believe I represent those 250, a quarter of a million people in El Paso who don't have health care insurance. Are they for health care reform? You bet you they are, Senator.
Let's talk a little bit about the business case for doing this. You know, you go to different business forums and some of these business groups are saying, no, we're not going to do it because we don't want to pay. And the fact is that for most of them, the great majority of them, it's going to be better after reform. When you talk about a big company, let's say Dell, who's been covering its the employees with health care for a decade or more, what would be the impact on, say, a Dell Computing if you had health care reform at the national level?
I think for them, it's not going to really affect them at all. They have health insurance. One of the things about the president's plan is that he talks about the public option. If you work at Dell, the job that I have, if I'm happy with my health insurance, it pays what I am fortunate that I do have health insurance. And that if I want to keep that health insurance, I can keep that health insurance. So in a sense, the public has to understand that this is an option, the public option, it's an option. If you have private health care insurance and you are happy with it, you are more than welcome to keep it. It should not affect you.
So your choice is to take it, keep it, and take it to the next job. So if you go to another job, your health insurance policy is going to follow you to that job.
Correct.
So in terms of those that are insured and like their insurance policy, nothing happens.
Correct.
Maybe the cost of it is going to go down for
because
the employer
of the competition.
Because of the competition and what's induced. But in terms of the patient, you get your health insurance, it goes with you. And when you lose your job, if you do, God forbid, you'll still have health insurance.
And it'll cover you for a pre-existing condition. Right now, if you have health insurance and you lose your job for whatever reason, if you have a heart disease or God forbid you have cancer and you try to get insurance, you'll be denied.
Let's talk about smaller businesses. Let's take those businesses that cannot afford to cover their employees. There's about 18,000 small businesses in El Paso. In the president's plan, folks making a certain income level are going to be covered with insurance through a different variety of choices, tax credits, mandates, and other things that will get them covered. What would happen to, say, employees that are at the 85% above the poverty level here in El Paso, Texas, under the president's plan, or what's been proposed in Washington, D.C.?
There are a lot of options. You're talking about the insurance. I can't remember the word for me. It's not. You got to help me, Senator, on this one. Savings accounts, health savings account. They're providing where the employee can actually save his money to help pay the premiums for his insurance. So there's a lot of options. One of the best things about the private insurer is that everybody thinks that the small employee is going to get penalized if he does not provide health insurance, and that is not the case. They're going to have a cap in terms of the amount of income that a business has for him to provide health insurance. Now,
I think that cap really is $500,000.
$500,000.
So if your company is doing less than $500,000 a year of business, then you're not affected at all.
Correct.
And as a matter of fact, your employee is going to get health insurance because we're going to make it part of a national health insurance initiative to make that happen. So the best thing is, instead of feeling guilty about this employee who has not had coverage, that employee will now be covered. So if you're at 25 employees or making less than $500,000, which is 90% of the businesses here in El Paso, not affected at all. I think these are the points that,
that
need to be made at these town hall meetings.
And from an economic perspective, you know, as an employer, I would like my employees to have insurance because my premiums could be tax deductible in the private market. And not only that, my employees are more productive, they miss less work, and I make more money.
That's exactly right. Well, Dr. Luna, we could talk for another 2 hours, and hopefully we'll have more time on these TV sessions to talk about health reform in Texas. If there's a state that needs it, it's Texas. And if there's a city that desperately needs it, it's El Paso,
like
Texas.
Like you said, we are ground zero for health care reform.
We are ground zero for health care reform. And of all the cities in this great nation that would benefit from this, it is El Paso, Texas that benefits the most. We've had a great time here with Dr. Joe Luna here in El Paso, Texas. We invite everybody to come to our town hall meeting on health care reform. Please come to the community college at 7 o'clock on August the 27th, right here in El Paso, Texas. Good to see you. Until next time, we're here in El Paso, hoping you the best.